Health service experiences of Indigenous Australians vary from that of non-Indigenous Australians with great disparity, despite health campaigns to address these. Health services have been absent or inappropriate for the Indigenous community. For example, accommodation for Indigenous community members in the public hospital system was kept segregated until the 1960s. To address this, Aboriginal Community-Controlled Health Services, ACCHS, were established to improve Indigenous access to adequate culturally appropriate health services. The ACCHS are guided by principles to achieve equitable funding, culturally appropriate healthcare services, recognition of different communities and their needs, the centrality of kinship, the right to self-determination, and concepts of health from a holistic perspective to address the distance, cultural, and financial factors impacting adequate access to health services by Indigenous Australians. Distance factors. The presence of a health service does not imply it is accessible. For example, Indigenous people in rural towns may not have transport to attend healthcare centres or have access to specialist doctors located in cities or Indigenous doctors who provide culturally appropriate care. Cultural factors. Of the Indigenous people who encountered problems with accessing health services in 2008, 7% stated it was due to not being culturally appropriate, and 10% said they didn't trust the health services. Health services that are accepted are culturally appropriate, performing from positions of respect and cultural sensitivity. They provide comprehensive and non-discriminatory services. Typical general practice is an important source of health care for Indigenous Australians, yet Indigenous clients form the minority of patients. Financially, Medicare expenditure per person for Indigenous Australians was 39% of what it incurs for other non-Indigenous Australians in 2001-2002. Recognising low levels of access to health services combined with inadequate funding contributed to the poor health status of New South Wales Indigenous Australians. Funding increased as of 2010-2011. The health expenditure for Indigenous and Torres Strait Islanders was 1.4 times greater than the $5,437 spent per non-Indigenous Australian. Furthermore, eradication of co-payments on medicines has helped improve accessibility to prescription medication. The S100 scheme allowed the ACCHS to make bulk purchases and dispense medicines to Indigenous clients without requiring co-payment. The Australian government introduced Closing the Gap in 2008, a government strategy that aims to reduce disadvantage amongst Aboriginal and Torres Strait Islander people with respect to life expectancy, child mortality, access to childhood education, educational achievement, and employment outcomes by 2030. This slide summarises the measurable targets of Close the Gap. In conclusion, the experiences of the New South Wales Indigenous Australians when accessing healthcare services can be described as challenging and difficult, but has gone through a particular process of evolution from the days of segregation within hospitals dating back to the 60s to having initial Aboriginal community-controlled health services established in the early 70s. Moving forward, factors that have contributed to an overall lack of access to health services have been identified to be addressed. Issues of past injustices and racism have hindered New South Wales Indigenous Australians. However, government initiatives such as the ACCHS and Close the Gap have offered more reliable health services to New South Wales Indigenous Australians.